Are there other disorders that are associated with acoustic neuromas?
Acoustic neuromas are associated with certain disorders that physicians need to keep in mind when evaluating patients. We've already previously talked about how acoustic neuromas can be associated with neurofibromatosis type 2, which is a genetic inherited disorder that is associated typically with acoustic neuromas in both ears. So in a patient with neurofibromatosis type 2 or NF2, it's fairly common to have other family members with this disorder. So you need to do an appropriate workup of the family history to see if this disorder runs in the family. Patients with NF2 also, in addition to acoustic neuromas, can develop other tumors in their brain. Typically, these are called meningiomas, which are another type of benign brain tumor. They can develop tumors in their spine. We typically see these as spinal cord ependymoma tumors. We also know that acoustic neuromas can be associated with other types of related disorders as a result of the tumor being present inside the patient's head. One of these common disorders is called hydrocephalus. So hydrocephalus is a disorder in which there is a fluid imbalance in the brain. Your brain typically makes this fluid. It's roughly 2 soda pop cans worth of this fluid a day, and your body needs to absorb the same amount of fluid to keep this fluid in balance. This is the fluid that the brain and the spinal cord float around in, and the fluid protects the brain from any type of sudden trauma or jarring motion in which the brain would strike the skull. So acoustic neuromas are associated with increased protein production, and the protein can leak into this fluid and increase the amount of debris in the fluid, and this can further result in a fluid imbalance. So if a patient develops hydrocephalus, the main symptoms are balance disorders and sometimes headaches and urinary incontinence. And we have to keep those symptoms in mind when assessing a patient with acoustic neuromas.